We're very lucky to have Governor Douglas. He has an amazing background in state and local government and a very practical leader. He was both in the Vermont House of Representatives, Secretary of State, State Treasurer, and Governor for 4 terms. I think he's got an amazing background when we look at the state aspect of what we're doing, and we're very glad to have a governor on the board. He's been able to give us great perspective on how to work with states and governors and chiefs of staff, and really trying to make sure that we're communicating in a way with states, with our single point of contacts, but also with all the right stakeholders to make sure information is flowing. He's also been a very good voice for how do we communicate, kind of these complex topics and share them with state leadership. And so I think you will find, like we have, that Governor Douglas is a terrific addition to the board and is a very active and interactive member with all of the staff, and we appreciate that.
Obviously, I talked about the governor's role in approving the plan and assured them, as we discussed yesterday, that at the time the plan is presented to the governor, it shouldn't be a surprise. It's not like FirstNet's going to secretly concoct some plan and then plop it on the gubernatorial desk. It's going to be developed as the consultation process is underway, and so at that point, there shouldn't be anything unexpected in the state's plan. So I hope that we'll maintain those lines of communication, and I want to suggest to all of you that I'd be happy to talk with your governor directly if that's appropriate and helpful.
Making that recommendation to a governor, bringing your group to consensus, whatever that governance structure is, it's going to be a harder job than I'm going to have developing the state plan. Coming to consensus, ratifying that document, making a recommendation to a governor is going to be a really hard job. We get that. I mean, it's tough to bring people to consensus. I mean, my job is to bring sort of 56 groups to consensus. Your job is to bring thousands. I mean, Todd's going to bring 8,000 agencies to consensus. It's going to be a tough job, and we recognize it's going to be tough. We're here to support you. We're here to help you. We want.
Can we go target events? We hear often, well, public safety uses this amount on a day-to-day usage, but how much does that peak when there's some type of incident? And we have some data that we've collected through market research, but we don't know if how valid that data is, and we don't know how that might vary from state to state or incident to incident. So really some specific benchmarks of how much data is used, not only in a day-to-day event, but as that escalates from a response type. And we know that's going to be difficult, and that's going to be a challenge, and it's going to be very specific and targeted, but that's definitely, as I think you can imagine, a very key metric that we're after in this data collection process. So really, when you put these 3 elements together, where's coverage needed, how many users does that represent, what are their operational areas, and then how much are they going to consume, those are really the key elements that we're driving for to help inform our RAN design and ultimately the state plan delivery.
We're also going to engage the local first responders on who's using those mobile data tools, the data collection, the data monitoring, the data management, because that again is that gold mine of data that we're all sitting on in some way, shape, or form that becomes extremely important for not just FirstNet, but really for the local first responders, for you. You have to understand the data and how you're using it now, how you're using your application.
Where are all of your law enforcement units at? Where's your hospitals, your triage units, your burn units, evacuation, what's mandatory, what's voluntary, what percentage do you have notified, what percentage do you not have notified, so that you know where to send folks to do evacuations. This application is not developed, but this gives you the innovative way of thinking of what this type of technology could provide to your first responders that are out there. So all of this is on that.
We really go out of our way to look at every single response and evaluate it for what it is, right? In order to help our decision making. So we want responses from as broad a group as possible, with as detailed as responses as possible, but nobody gets extra weight. One of the key things about this notice and comment process generally is to ensure that everyone has fair and equal access, right, to respond to a public notice, and that their voice is heard.
All of these things are great, and they're going to save lives, and they're going to transform the practice of EMS. But with the communication system EMS has now from 1972, with data transmission speeds of dial-up internet 20 years ago, we can't do it. We simply can't do it. But that's the wonder of FirstNet, and that's why I, for my part of it, have pushed for 7 or 8 years to help bring us to where we are today. And I hope that that little bit of knowledge will help to ground you in why the heck we're here today and what we need to do. Thank you very much.